Well, Sue, thank you very much. And Joe, that was absolutely fabulous. And despite all of those awards, I still get very nervous about my screen sharing, and I'm so relieved it's worked. Joe, I was noticing that last slide, that plane sure was having a steep takeoff. But anyway, what I wanted to say basically is that we've been cleared for takeoff, but what we need to make sure is that actually we don't abort and we don't have to land again. And we're in quite a critical period just now because we're still in COVID, and Chris Whitty says we're going to be living with it for the rest of our lives, well, his generation and mine anyway. And, you know, the world is very unsettled with what's happening in Ukraine, and midwives are feeling tired. And at this critical point, it seems to me that it's really important that we move forward with the kind of wonderful policy that we've got in the United Kingdom, but also that we recognize that there is not the option to stay the same. Basically, people will say, you know, we should just leave things as they are. We should just make a few changes and leave the transformational change, the fundamental change till later. But what scares me more than the change is staying the same, because I can see that the services aren't sustainable as they are. And Joe, what struck me about your presentation was that you both took this very, very broad view that this is generational, that we will impact on generations of people. But you also talked about this being about relationship and love and belonging. And if you think about birth, that is what birth is about. Your top 10 tips were wonderful. I went through them earlier and I ticked every one of them. And you talked about us being on a journey. And I think that that's really important to recognize that we're on a journey. And you also talked very much about planning. And the planning that you talked about was extremely, extremely detailed. And I think that that combination of having a big picture and doing the planning is really important. So I just want to take us back quite a long time till 1991. And this idea of us needing transformation of the maternity services, fundamental change of every part of the service, of the culture, of the systems, of the structure, and so on, was born. And this is called the Winterton Report. It was House of Commons Select Committee on the Maternity Services. Nicholas Winterton chaired it. And the story at that time was that Nicholas Winterton had kind of taken this on a bit lightly. But then as they started to make visits and talk to women and their families, he started to understand just how important, just how fundamental it was. And it was inspired really this House of Commons Select Committee inquiry into the maternity services by Audrey Wise, the late Audrey Wise, who was a wonderful Labour MP. And her daughter-in-law had been receiving maternity care. And she made the case that although we seemed to have safe outcomes, there was much unhappiness. And the phrase was that all was not well with the maternity services. But what I really love about this pale blue book, this wonderful read, is it starts with the sentence, "What happens in pregnancy, birth, and the early weeks of life is of the utmost importance to all of us." And with that sentence, we get the idea that birth doesn't belong to professionals. It doesn't belong to the health services. Birth belongs to each and every one of us, and we must all take an interest in it. It will, in fact, affect our future. Now, I gave evidence with the Royal College of Midwives to this hearing, and it was a wonderful event because the books Effective Care in Pregnancy and Childbirth had just been published. And so we had all of the evidence at our fingertips, and we were prepared very, very well, and we gave very evidence-based responses to questions. And continuity of carer came up in a number of places as being fundamental to the change that people wanted to see. Caroline Flint was a midwife advisor to that committee. And in fact, we already had quite a bit of knowledge about team midwifery, or group practice, as I called it, or one-to-one midwifery, which I've been involved in setting up in Queen Charlotte's and Hammersmith Hospital. So we had quite a bit of knowledge. And when I went back through this book, I thought, actually, we knew quite a lot then, but we've got much more evidence now. Then the response to this was changing childbirth. And this really was a fundamental change. You see the bright orange book. Now, this reads beautifully. I was the midwife on the expert maternity group. It was chaired by Baroness Cumberledge, who continues to lead some of the most progressive change in maternity services in the world. And things were simpler at that time, and it reads more simply. And there were 3 principles of good maternity care. The woman must be the focus of maternity care. She should be able to feel that she is in control of what's happening to her and able to make decisions about her care based on her needs, having discussed matters fully with the professionals involved. Maternity services must be readily and easily accessible to all. They should be sensitive to the needs of the local population and based primarily in the community. Women should be involved in the monitoring and planning of maternity services to ensure that they are responsive to the models for changing society. In addition, care should be effective and resources used efficiently. Now, it's hard to remember that that term effective care was a very, very new one at that time, but it was fundamentally important to everything that we're doing. And since this policy, every other policy document, including Better Births in England and Best Start in Scotland, are based on these principles. They're not easy to achieve because we've got a large factory system, an NHS, which is actually one of the most effective and efficient in the world, looking after a lot of people. So moving to this truly personalised care by continuity of carer is quite difficult to achieve. But I would argue with you, it's essential and worth it. So I would say that we can't stop where we are. We can't wait for a moment until our problems are sorted out. We actually need to change to sort out the problems that we've got at the moment. We need to choose to go forward. And actually, in fundamental change or transformative change, you transcend the problems, you overcome them. And continuity of care is not all that we have to implement, but it is a mainstay. We've got the evidence, we know what works. We know that with properly set up midwifery continuity of carer, there is a lower risk of burnout for midwives and potential for deep satisfaction. Not all midwives have to provide continuity of carer to make sure that every woman has continuity of carer by default. And midwives want to move into it and out of it over their lives, or they might not want to do it at all. But probably about 40% of midwives, I don't know if Jo agrees, would need to choose to work in this way. We know that current services aren't sustainable, and we know now that there is support and there are resources. And NHS England, with its detailed documents and its planning tools and its building blocks, are an absolute godsend to anybody planning and setting up continuity of carer. So to add, or perhaps to bring together Jo's 10 top tips, I would say that what is absolutely critical is leadership. And Jo, just using you as an example, and I know that there are other directors of midwifery, heads of midwifery, regional chief midwives who are doing similar work. What you show is leadership. You show the vulnerability and that you need support. But I would say that if I had you as a pilot on my plane doing the takeoff announcement, I would feel very, very confident in you. And I think in a way your vulnerability, your wanting to ask people to support you, to consult and to engage with others is really critical to that leadership. We need a vision, a clear vision. And yes, we can say this is challenging, it is difficult, but it's important, it matters, we need to do it, and I'm with you all the way. The planning is absolutely critical. As a director of midwifery in my last director of midwifery job at Guy's and St Thomas's, we had somebody actually leading on the development of midwifery continuity of carer, because I, as a head of midwifery, director of midwifery there, felt that I couldn't do it. It wouldn't leave me enough time to look at the rest of the service. So sometimes the director of midwifery, head of midwifery needs assistance. We need to start with community-based practices, and we need the support and resources that we've got from NHS England. And I have to mention too, the other 3 countries of the United Kingdom are all developing continuity of carer. So all I'm going to say now, Sue and Jo, is that I think Jo has given a highly credible how-to, and I'm sure that she would be willing to help others who are feeling nervous about making this journey. Making midwifery continuity of carer the default really matters and will make a difference. Planning the route, knowing where we're going, knowing how we're going to get there, believing and committing to change are really important. I'm not going to go through the 10 top tips, but what I would like to say to all of the midwives and other birth workers and others listening is, yes, this is a challenge. It's part of a much bigger program of transformation, fundamental change, what I would call humanizing childbirth. Humanizing childbirth is recognizing that birth is a time of transformation for the baby being born, for the woman becoming father, for the woman becoming mother, and for the partner becoming parent, and for the family being formed. And they will make a huge difference to our future. And midwives working with women will have the opportunity of truly working with women, talking with them about the kind of experience they want, what's important to them, and ensuring that they get the care that's appropriate for them, and making sure that's available for all women in our service, so that we know that at that time of birth, which will affect them and their baby for the whole life, but future generations as well, and our whole world and society, I would say to you that it's worth it. Jo, I'm ready to take off, and I'm very, very willing to take off with you and everybody who's with us. Thank you.